What if I told you that your body might be whispering a warning about a deadly disease, one that's often ignored until it's too late? Colon cancer is one of the most common and dangerous types of cancer worldwide. But here's the good news. If caught early, it's highly treatable. The problem? Many people miss the early warning signs. That's why today, we're breaking down 10 silent signs of colon cancer that you absolutely cannot afford to ignore. And stick around until the end because we're revealing a powerful natural remedy that can help reduce inflammation and lower your cancer risk. Let's get started. Your gut works like a well-organized highway, smoothly transporting waste out of your body. But what if traffic suddenly slows down or speeds up? That's when you need to pay attention. Warning signs to look for: going to the bathroom much more often, or much less often. Stools becoming unusually hard and dry, also known as constipation. Sudden, persistent diarrhea with no clear reason. Your intestine is like a mirror reflecting your overall health. If you notice a sudden, unexplained shift in your bathroom habits that lasts more than a few weeks, it's time to call your doctor. What you can do: eat fiber-rich foods like whole grains, fruits, and vegetables. Drink plenty of water to keep digestion running smoothly. Stay active. Exercise helps keep your digestive system working properly. Blood in your stool might be shocking, but don't panic. It's not always cancer. It could be hemorrhoids, anal fissures, or even a minor infection. But here's the catch. Colon cancer can also cause internal bleeding. What to look for? Bright red blood may indicate bleeding near the rectum. Dark, tarry stools could mean internal bleeding deeper in the colon. Persistent bleeding that doesn't stop over time. What you should do: don't just assume it's nothing. Schedule a checkup. A simple test could determine if the bleeding is harmless, or if it's a sign of something more serious. Everyone experiences stomach pain now and then, but persistent, unexplained pain is different. Colon cancer can cause cramping, bloating, and discomfort as a tumor grows and interferes with digestion. Signs to watch for: pain that doesn't go away after meals, a bloated, full feeling even when you haven't eaten much, unexplained nausea or vomiting. When to see a doctor? If abdominal pain becomes a regular part of your life, especially with other digestive changes, don't ignore it. Imagine finishing in the bathroom, but something feels off, like there's still more, but nothing else comes out. This uncomfortable sensation, known as tenesmus, can occur if a tumor is partially blocking your intestine. What it might feel like: a constant urge to go to the bathroom, the sensation of still needing to pass stool even when your bowels are empty. This symptom may seem minor, but if it becomes persistent, it's time to talk to your doctor. Losing weight without trying might sound great, but sudden, unintentional weight loss is often a warning sign of serious illness. Why does this happen? Cancer cells use up the body's energy, causing weight loss. Tumors interfere with nutrient absorption in the intestines. Chronic inflammation disrupts your body's ability to maintain weight. When to take action? If you're losing weight rapidly, 10 or more pounds without changing diet or exercise, get checked out immediately. Feeling tired all the time? Not just normal tiredness, but a deep, unshakable fatigue? Possible causes related to colon cancer? Slow internal bleeding leads to iron deficiency anemia, making you feel weak. The immune system fights cancer cells, draining your energy. Poor nutrient absorption leaves your body exhausted. Don't brush this off. Chronic fatigue is a serious symptom that needs to be checked out. Anemia is one of the most overlooked symptoms of colon cancer. It happens when your body doesn't have enough healthy red blood cells to carry oxygen throughout the body. You might not even realize it at first. Fatigue and dizziness can creep in so gradually that you start to believe it's just stress or lack of sleep. But what if your body is actually crying out for help? Why does colon cancer cause anemia? Colon cancer can lead to slow, hidden internal bleeding in the digestive tract. Over time, this constant loss of blood depletes iron levels, making it harder for your body to produce red blood cells. Unlike a visible wound, this bleeding is internal, making it easy to miss, until symptoms start to take a serious toll. Common signs of anemia linked to colon cancer include extreme fatigue that won't go away, even with rest. Feeling lightheaded or dizzy when standing up too quickly. Cold hands and feet, even in warm weather. Shortness of breath, even after simple activities. Unusually pale skin or a washed-out appearance. Brittle nails and hair loss. Your body isn't getting enough oxygen. What should you do? If you're experiencing chronic fatigue, dizziness, or shortness of breath, don't brush it off as just getting older or not drinking enough coffee. Ask your doctor for a blood test, especially if your iron levels are low with no clear cause. Catching anemia early could lead to an early cancer diagnosis, potentially saving your life. Extra tip: If you've been prescribed iron supplements but they aren't improving your symptoms, push for further testing. Don't let anemia go unchecked. Shortness of breath is often associated with lung problems, but did you know it could also be a hidden symptom of colon cancer? How are colon cancer and breathing problems connected? When you're anemic, your blood isn't carrying enough oxygen. As a result, your heart and lungs have to work overtime to deliver oxygen to vital organs. This can leave you feeling winded, breathless, and exhausted, even while doing simple tasks. Red flags to watch for: feeling out of breath after climbing stairs or doing normal activities, struggling to catch your breath while sitting or resting, feeling like you're not getting enough air, even though you're breathing normally, increased heart rate or palpitations, as your heart compensates for the lack of oxygen. When should you see a doctor? If you're struggling with shortness of breath and fatigue, get checked immediately. Many people assume their lack of stamina is due to aging, weight gain, or lack of fitness, but in some cases, it's a serious red flag. Helpful tip: if you're consistently short of breath, track your symptoms. Keep a journal noting when and where you feel breathless. This can help your doctor connect the dots and rule out more serious conditions like hidden internal bleeding. Bloating happens to everyone. Maybe it's that extra slice of pizza or a little too much carbonated soda. But what if your bloating becomes persistent, lasting for weeks no matter what you eat? What does bloating have to do with colon cancer? Colon cancer can block normal digestion, preventing gas from moving through the intestines properly. The result? Built-up gas, bloating, and pressure in the abdomen. When bloating is more than just bad digestion, frequent bloating that doesn't go away even after dietary changes, feeling full quickly even after small meals, stomach distension, a visibly swollen belly, pain or pressure in the lower abdomen that comes and goes. When to see a doctor? If bloating persists for several weeks and is accompanied by unexplained weight loss or changes in bowel habits, you should seek medical attention ASAP. Colon blockages caused by tumors can lead to serious complications, and early detection is key. Pro tip: try eliminating common bloating culprits like dairy, gluten, or artificial sweeteners. If your bloating still doesn't go away, it's time for a medical checkup. Are you eating less and less without trying? A shrinking appetite might seem harmless, but if it's happening without a clear reason, it could be a warning sign of colon cancer. Why does colon cancer cause loss of appetite? The tumor itself may interfere with digestion, making food less appealing. Inflammation disrupts hunger signals, making you feel full even when you haven't eaten much. Your body is redirecting energy to fight cancer, making you less interested in food. Red flags to watch for: feeling full quickly, even after just a few bites. Food no longer tastes good or has a metallic taste. Unintentional weight loss with no change in diet or exercise. When to take action? If you've noticed a significant decrease in appetite lasting more than 2 weeks, along with other digestive symptoms, see a doctor. Extra tip: loss of appetite doesn't always mean cancer, but when combined with fatigue, weight loss, or bloating, it should be investigated. Bonus tip: the anti-inflammatory power of turmeric. Did you know that turmeric contains a compound called curcumin, which has been shown to fight inflammation and potentially lower cancer risk? How to use turmeric for gut health and cancer prevention. Add 1 teaspoon of turmeric powder to warm water and drink it daily. Mix turmeric into smoothies, soups, or tea for added benefits. Combine turmeric with black pepper to increase absorption. Bonus fact: studies have found that curcumin may help reduce the growth of cancer cells and protect the gut lining, making it an excellent addition to your daily routine. Final thoughts: don't ignore these silent symptoms. Colon cancer is highly preventable when caught early. If you've noticed any of these symptoms, don't wait. Get screened now. Eat a high-fiber diet with plenty of fruits and veggies. Exercise regularly. Staying active keeps your gut moving. Get screened if you're over 45 or sooner if you have risk factors. Did you find this information valuable? Give this video a like and share it with someone who needs to see it. Your support helps spread life-saving awareness. Subscribe and hit the notification bell so you never miss our latest health tips. Stay safe, stay healthy, and take care of your gut.